You were told that you couldn't have LASIK, so you thought it was over.
Exactly.
Exactly.
Yeah.
I thought, okay, well then I accepted the
Blind
fact,
for
or
life.
what I thought was a fact, that
Right.
I'm either going to be blind for life, or I'll just have to wear disposable contact lenses for the rest of my
That's
life. You
right.
have literally opened my eyes.
Yes, and opened our audience's eyes.
Yeah, you
That's great. I
have.
hope we get a lot of people to see it
I know.
because
For sure.
it's so life-changing
For
when you
sure.
do this.
You are giving people back
And we
their
love
vision.
it because it doesn't, at the ICL, even, it doesn't change a thing.
Welcome to Care Experts, a podcast dedicated to empowering you with knowledge for your health and self-care. I'm Melissa, a broadcast journalist.
And I'm Selah, a former fitness coach and personal trainer.
Each week, we interview top wellness and medical specialists from across the country, addressing your questions, even those you might be afraid to ask.
From your fur baby's well-being to skincare secrets to honest talk about bigger health issues, get it straight from the expert.
Join us every Wednesday for insights that will guide you on your health journey.
From cosmetic to dental and vet to vision, this is Care Experts.
Literally, I feel like my entire life I have been wearing contact lenses.
Goodness.
And I am like, okay, is there anything I can do? Every year I go, Selah, to my annual appointment, and my eyes have kind of like stabilized as far as my vision is
Right.
concerned. And I've kind of got, I mean, not kind of, I'm totally used to wearing corrective lenses every day. But man, it'd be so good if there are other options out there.
I know. Well, that's what we're going to find out today. I had LASIK, as you know.
Oh, yeah.
Yes, and I loved it, but I know you've said that you weren't a
Well,
candidate.
that's what they told me. I'm not
Right.
the expert, so I don't know. But they told me that I wasn't a good candidate for LASIK surgery because I have astigmatism. But that was like 15 years ago. So I'm sure the technology has improved tremendously.
Well, I think so because we're talking about things like ICLs, RLEs today, and I don't even know what those are.
I know. I was like, what does that stand for, right? But like, as far as vision correction is concerned, I am always open to new options and anything where I don't have to have my contact lenses and every day putting them in, taking them out, making sure I have another pair, making
Wouldn't
sure.
that be nice?
Oh, it'd be so nice.
changer.
Yeah, and I love that our expert today, Dr. Sheri Rowen, is going to be the perfect person to tell me what my options are now
Yes.
and if I'm a candidate for LASIK or whatever else there is out there.
Exactly.
And Dr. Sheri Rowen trained at the University of Maryland Medical School and Johns Hopkins Hospital.
Yes, she formed the Department of Ophthalmology at Mercy Medical Center in Baltimore.
And she's pioneered new treatments and techniques for cataract surgery that have included demonstrations through live surgery in France, Italy, Sweden, Brazil, and Australia. Wow. Like multiple continents is what we're saying here.
Live surgery.
Demonstrations
Okay.
during live surgery.
Amazing. She
I know.
serves as the medical director at Envision Eye Centers and is certified by the American Board of Ophthalmology.
So what it sounds like is she's super qualified.
She's the expert.
She's the person to go to. And oh gosh, you know what I'm so hoping for? My fingers are crossed for people who are not watching right now. My fingers are crossed that she's going to tell me, yes, I'm likely a good candidate to have something other than contact
I
lenses
hope
every
so
single day.
too,
Yeah, I
for
want to
your
be like
sake.
you. I want to be like you. And
I
not
want your
need
life
a-
to be changed in that
Aw,
way.
me too. And let's
It'll be
see,
good.
let's see what Dr. Rowen has to say. Come on
Yes.
in here, Dr. Rowen.
Welcome, Dr. Rowen. We are so happy to see you. Yes.
You're the OG, so I know you're going to keep it real with me. I have been wearing contact lenses since I'm like 12, 13 years old. I would love to no longer be in contact lenses. Let's pretend I'm your patient. What's the first step? I come into your office, go.
And you know, it's interesting because it would be important to include both of you.
Yeah.
Because let's say you hadn't had LASIK yet, but you're
Okay.
wearing contacts. You've been working as an actress
Yes.
and you were dry on
It's the work. Well, I did do that before
you
LASIK.
couldn't
It was
keep
horrible.
your eyes open. So dry eye happens.
Okay.
One of the reasons is use of contact lenses. Why does that happen? A couple of things. One is it's an irritant in a way to the local tissue. Some people get away with it throughout their lives and never have a problem. So that happens. But others don't blink their eyes fully because the contact lens is covering the cornea.
Oh.
So they don't feel the drying out of, because it's got a little layer of aqueous or a little layer of the tear film under it. So the eye doesn't know it's dry.
Okay.
So now, and this happens with screens, staring at your screens. All the kids today, we're seeing this
All of us.
as
All
an
of us, yeah.
epidemic. I can hardly go in a day and not see a dry eye patient. So we're going to go back to your thing. But what happens is, so they don't blink thoroughly. When they don't blink thoroughly, we don't release the natural oils of the eye so that the tear film doesn't evaporate.
Okay.
So we have
doesn't
layers
lubricate,
of the tear.
self-lubricate.
Yeah, we have layers of the tear film. One is more of a watery type of layer with mucin, it's called. So that's one layer, and then we have the lipid layer, which is what we get from our eyelids. So we can measure people and look at them, and they're half not blinking.
Wow.
So that happens with contacts. So long-term contact lenses can cause that dry eye. Now you've come in to me. Let's say you come in and say, I just want to be out of my contacts.
That's it, really.
You come out, you just don't want to wear them. You've come in and said, I have dry eye.
Okay.
So dry eye, we have to treat. There are medications we use. So we're going to go through that.
Okay.
We have procedures that we do. You're not dry anymore that you noticed because you had your eyes
LASIK.
correct.
Yeah.
So you don't wear contacts anymore. You come in and say, I just want to get this out. So for an ICL workup or LASIK workup, we do the measurements of the eye, and we always look for dry eye. We call it ocular surface.
Even if I don't feel like I have it, because I haven't felt like I have dry
That is
eye.
correct.
Okay.
Because what's interesting is a lot of people come in, they have no idea they have dry eye because the nerves have become desensitized.
No way.
I just thought I was lucky.
So
You might be.
I really did.
But you might be.
I might be.
I don't
okay.
know. I mean,
you'd have to
I'm
use
just-
equipment to
we
like
have
find
to
that
look
out.
at
Sure,
it.
Yeah.
sure.
We
Up
check
close.
it out,
right.
and we find out if
So cool.
yeah, it's
Wow,
crazy.
that's crazy.
Because now the patient doesn't know they have it, and all of a sudden we're telling them you have it, and they go, "What? I don't feel anything."
Yeah.
But we see it. So we have to look. We have to ask you questions. So first questions are to use artificial tears ever. Do you feel like your eyes are dry or irritated, or you're fluctuating your vision? You have to blink to clear your vision. You know,
That's how I
things like
felt.
that.
Yeah.
Right.
Yeah.
And they're sandy, scratchy, all itchy, any of those things. So we ask all those questions. Any of those things, we really go further into seeing why your eyes might be dry. And then we can prescribe medication. We have all kinds of new drops that we use. We have procedures if the glands are not producing the oil. We warm the lids. We can help to express the glands so that they can start working again. So we do all of that as well. Now let's say you don't have dry eye, and I will do measurements for you. I will do a certain number of things. We pick out what your lens is. We order it about a week in advance. You come in next week, but bam, you're done.
But bam,
That's
you're
the-
done. Now I can see.
Wait, that's it. That's the total consultation right there.
Well,
Measuring,
it's a little bit in depth because we
Sure.
have to-
Okay, yeah.
Sure.
we dilate with, especially somebody who's nearsighted.
You do
We want to
dilate
make
the
sure
eye.
we do.
Okay,
We
okay.
want to make sure that there are no retina problems, so we check for that, and we check for ocular surface, the dry eye or something else, and then we do measurements to check the inside of the eye to make sure it can contain that EVO ICL.
You said something I just want to talk about really quickly because I have a son. You have 3. My son is on his tablet sometimes, a lot more than he should be.
Right.
I'm being
Right.
honest here.
Right, same.
I thought that the reason his pediatrician was saying he shouldn't be on his tablet is because, well, he should be playing outside or he should be doing something that's not in front of a screen. But
That is part of it, and I'm going to tell
of
you
course,
why.
but
There's
when
a
they're that
reason.
young and in front of a screen, could that impact his eyes to a point where he could have dry eye onset earlier?
Not only can it do that,
Oh, no.
I know,
it
I
can
know.
also make them more nearsighted. We have an epidemic of what's called myopia, which is
Yeah.
nearsightedness
Right.
throughout the world right
Oh
now.
my gosh.
By 2050, 50% of the entire population will be nearsighted
Oh my gosh. And it's because of screens?
because they're sitting there like this. They need to be outside in sunlight,
Yeah, yeah.
playing, doing the things we did when we were
Normal,
children.
Right.
yeah.
When they sit here all day and are staring, there's something about it that triggers
Of course.
the nearsightedness. So they're testing drops for it. They're testing all kinds of this, try to prevent this. In Asia, it's horrendous. The number, if you look at the graph, it's going like this.
That is
Is
terrifying.
it they're on screens
Terrifying.
more than us in Asia?
Yeah.
Oh wow,
Yeah.
okay.
And the problem is so not only do they get nearsighted, they can get what we call pathologically nearsighted. You can have too long of an eye, and then the retina stretches, and they can get little cracks in the retina, and they can get all kinds of things. So we really don't want them to sit in front of screens. If you're going to have them watch something, at least make it further away.
Yeah, like
Sure,
the
that
regular
makes sense.
TV.
A regular
or something
TV
like
is
that.
a little bit better.
Right.
And of course, when we're on this screens, digital devices, or we're on computers. Okay, natural blinking is about 20 times a minute. We've clocked it when you're staring at the screen. It goes down to about 7.
Oh no. Well, and here's what's horrible. In
And the
schools,
kids, they don't blink.
They don't blink.
But in schools, they use iPads now.
I
Yeah.
know.
So it's not just like when you said about Asia, I thought, well, wait a minute. It's not that they're on screen. They're probably using them in school.
Well, they're
Right.
using
And
them.
they're everywhere.
They're
everywhere.
Yeah.
And the blue light. You hear about, I hadn't heard about blue
yeah,
light
how does that
before,
affect it?
like
Well,
5 years
blue
ago.
light's a whole other story. In fact, I work with a company called iSafe.
Okay.
So it's iSafe Technologies. And we're making little screen covers and that don't change the color.
Okay, that's
So
nice.
Apple did the thing like the night.
Yeah,
light,
the low light,
but
the
it
dark
turns
light.
it yellow and you lose your color. These
Exactly.
actually don't affect the color.
Okay, that's
These filters.
nice.
So I really like this technology. A lot of computers are incorporating that into their screens now.
Oh, that's cool.
Dell has it, Lenovo has it, Acer has it.
Do you recommend kids wearing those blue light glasses?
Well, if they don't have it, they could wear the blue light, or you can put it on your iPad. You
Okay,
can buy them,
blue light.
Sure.
but it's called iSafe.
Okay,
I have to look for that for
Yeah.
my
Yeah,
kid's tablet and for my own tablet as well. For
and
sure.
it kind of
Seriously.
helps a little bit for the fatigue. The other part about the blue light blocker is that we are used to seeing blue light during the day, so our circadian rhythm is noticing it's blue. And then it turns dark. And now we're putting more high intensity blue light in from these devices, and the brain doesn't know to turn it off and go to sleep properly.
So it impacts your
So it
circadian
impacts-
rhythm?
Yes, it
Yes,
can impact
that
your
definitely-
circadian rhythm.
They say
Dr.
not to use it
Rowen.
after.
Yeah.
Dr.
So those are the
Rowen.
reasons. And the
know.
data is just starting to come out. So we
Sure.
don't have research proving or supporting a lot of this in terms of protection, but we know enough from what it does in scientific studies that we believe that we should protect against
Yeah.
it.
For sure.
What are some of the other? Well, I know we've talked about ICLs, we've talked about LASIK. I've heard about IOLs. Is that right?
So the lens implants for the cataract or refractive lens exchange are IOLs, intraocular lens.
Okay, so
That's what
that's for
IOL.
cataracts.
Okay.
And,
Yeah, for cataracts or you're replacing. Remember, I said some
Oh,
people 50 to 60 come in and they want their vision corrected.
Sure.
so that you don't need bifocals.
So you don't need bifocals.
Got it.
Makes sense,
Okay, that's
makes
the
sense.
IO.
Okay.
So IOL either can be just for distance, it could be for near, it could be for intermediate, it could be near,
Okay.
intermediate, and
Oh
distance.
wow! And is that very costly, or is that?
That's a few thousand.
But you can finance that.
CareCredit.
Yeah. I mean, to me, that's worth it. I don't want bifocals. This sounds fantastic.
Yeah. It
I will
really
finance
is
that.
very helpful. It's
Yeah.
really helpful to do that
Absolutely.
when you're ready.
RLEs. What is that term?
So
What does
that's
that
what we're
mean?
talking about here, refractive lens exchange.
Okay.
It is exactly the same procedure as a cataract surgery because we put an implant in,
Okay.
but we design it so to the best we can, you'll reduce your need for glasses tremendously. There might be you might need to pick it up for threading a needle or seeing small print or something like that.
What's the difference between that and IOL then, as far
It's
as
the same.
bifocals? Oh, it's the
An
same.
IOL is the implant that you put in those procedures.
Got it.
Okay.
Okay. So
Okay.
it's for the same purpose.
It's
though.
the same purpose.
Got it.
It's what you're using to correct the
It's
vision.
what I want. No more bifocals.
Right.
No
well, when that happens.
when that happens.
Exactly.
Yes, not yet.
Not
Thank
yet.
God.
Yeah. Let's hope you last a long time.
Yeah, there you go.
What are the different types of IOLs?
So you can have the things that insurance covers are just what we call the basic lens. It's just one-dimensional vision, starting out like let's say where you're sitting from me.
Okay.
Then it becomes clearer in the distance if you don't have astigmatism.
Which I
So-
do.
Yeah. So somebody who gets that lens who can't afford, doesn't want to afford, or can't, or hasn't understood the CareCredit options, would know that everything within arm's length, or maybe where you're sitting from me, it's arm's length and past arm's length and out, gets blurry. Past it, that from you in would be blurry.
Oh, gotcha.
basic.
Okay.
With
So
a
that would be
basic
the
one,
with
like a
basic.
basic
Then
lens.
the next level is called the toric, and that's Toric, toric lens. That corrects astigmatism and distance. Again, starting from where Selah is sitting from me and further out.
Okay.
Okay.
Okay. Then you have multiple focus points, multifocal lenses. Focal points are here, here for the computer,
And then
and
farther out.
far away. And then we have a lens called, we have a Panoptics, we have Vivity, we have Synergy, we have Odyssey, we have all these newer types of lenses that really have started in the mid 2000s that we've been putting lenses in that give you all of these. Now, some of those can cause some halos around lights at night. A lot of my patients don't even get the halos, which is pretty fascinating, but some do.
Well, that's because it's you, Dr. Rowen.
Oh,
Yeah.
yeah. I'm
have
not going to take credit for the halos.
But you have to let them know that that's a possibility.
Yeah.
Exactly.
Right.
So we tell them that if you pick this lens, you could get it.
Okay.
And we can change it out if they have to early on. We don't want to wait too late. But, so we have a couple lenses. We have one that's called the Clear View. It's a near and a far. So we have different lenses. And then we have that light adjustable lens. And the newer version of it, which is really exciting, I don't know if you can do it. It depends on what your corneas look like after LASIK. But if you've never had LASIK, it's really the one we're moving towards.
Okay.
But even if you have, then we do a form of mini monovision with it, so you can see a little bit up close and far away with one eye. One eye sees a little closer. But with the new light adjustable plus, they get some near vision built into each eye. So they're
so
seeing,
impressed.
This is
they're
amazing.
seeing
It really
I
is.
have a race car driver. He was my first one of that new generation, and I just saw him after he's had all his light adjustments, and he's reading things I could hardly see. I mean, tiny little print on the
super
card.
X-ray
He said
vision.
he has better night driving vision than he had before he had it.
Oh my gosh.
And his was a choice for him because he couldn't see the dashboard and he couldn't see.
For him, it's his
For
life.
him, yeah, and he's driving at night. So he was noticing some glare problems at night as well. He's so happy. His wife's getting it done now.
Oh goodness, that's amazing.
So that's it's brilliantly clear vision. So we have beautiful lenses that we tailor for each individual person based on their measurements or their underlying conditions. Some
Okay.
people can't have multifocal lenses.
It just depends.
They can pretty much all have the light adjustable, but the multiple focus ones where it's one and done, sometimes they have something wrong with their retina, or sometimes they have too much of a dry eye problem.
I see.
And we want to take care of them in a different way. And that dry eye thing affects women more than men.
Why is that?
Okay.
Hormonally?
Hormonally.
Okay.
So we used to see it around the perimenopausal woman. That was like,
that's our age.
We're about to be entering that.
40 to 44.
Hello.
Yeah.
Yeah.
and it starts, and you're sitting there going, why is that? Well, there's hormonal changes. There's different factors. Our diet is part of it.
Okay.
Our hormonal changes. But I'm telling you, it is not sacred to women anymore. We're seeing young men more and more and more and more. Gaming, computer, the whole thing, they're not blinking.
That makes sense.
We do that 20-20-20 rule. 20 minutes, take a break. Look 20 feet away, relax your eyes so you're not accommodating that whole time, and blink. Blink thoroughly. Blink, blink, blink.
Now I'm gonna
and
be blinking the
remember
rest
to
of the episode.
blink. Well, I learned about blinking when I was young because when I did my first cataract surgeries, they took a lot longer back then. And I remember my first day, I said, "My God, my eyes are so dry," and my mentor said to me, "You really didn't blink very much
have to
through the
blink.
whole day."
Yeah.
So now I consciously will see how I'm blinking. You just blink, and you'll feel your eyes tear up even a little bit more
Yeah.
when you blink more. That will lubricate your eyes. We just have not been schooled to blink
Yes.
properly.
Yes.
So it's not just women, but I bring it up as a women's health issue because it's classically been attributed to women and aging.
Interesting.
But we do see it in young women and men. Wow. And older men too. But it's more predominant in women.
If you're looking to improve your quality of life and you use your eyes every day to get around to see. I mean, it's vital, right? And so you want, I mean, and if CareCredit is an option for you, why wouldn't you
wouldn't
jump
you?
right
Well, why
on
wouldn't
that?
you?
It's a no-brainer.
And
For
it's
what insurance
usually
doesn't cover.
there's when you think about your eyes. Okay, let's talk. If you're talking about a $9,000 or $10,000 procedure in one of the higher levels,
Like you're getting everything.
right? Think about this. What do you spend on a car?
Yeah.
Tell me.
I mean, it depends
20,
on the car, but
30,
yes.
Sure.
40,
Thousands,
50,
thousands of dollars.
50,000,
Sure,
yeah.
$50,000.
Yeah.
Okay. How long does it last?
I mean, I
Well, it
lease.
depends.
So for me, it's 3
You
years.
got 3 years.
Sure.
All right, let's say you buy one,
Yeah, if you buy it.
but you're still paying for the rest of your life. Let's say you buy one. In a good year with a good car, you might get 10 years.
Right. Okay.
Okay?
Yeah.
You might get how many people keep their cars 15, 20?
No.
Not
People don't do that anymore.
especially
many.
not here in California.
Yes. No, because we drive so much.
All right. So now they've paid all that money to drive a car. We're talking about somewhere between maybe 5,000 to up to 15 if you have to pay for everything out of your head for vision for the rest of your life.
Rest of your life.
For the rest of your life.
I mean, when you think about it in those terms, I say that to people and they think that they can't afford something, and they go, oh,
Yeah.
wow, what are my priorities?
Wow.
Vision is for us, it's the biggest priority. I mean, obviously heart health and all of the things are important because you want to stay alive.
Right.
Okay.
Sure.
But let's say you're alive and you're doing well and you want to see and you want to enjoy your family and you want to enjoy your activities. That's vision.
Exactly.
And that's why for us, it's so critical and it's so rewarding to give that to someone.
So now it's time for our favorite
It's one of our favorite segments.
Ask the expert.
You're the expert, of course, Dr.
Yes.
Rowen.
Okay.
So these are questions that come in anonymously, and they are just people who listen to our podcast and they have questions for experts, but maybe they're too scared to ask them. But this is their chance. So we're going to ask you these questions. Here's the first one.
Okay.
So this person says, I'm considering vision correction surgery, but I'm worried about the potential impact on my eye health long term.
Yeah.
Should they be worried long term?
Well, there are some things that we have to discuss.
Okay.
Okay, yeah. What are the side effects?
So we have most of the dry eye that people have heard about with LASIK or other things. They probably had dry eye to begin with from the contact lenses. A lot of times they might not have known it, or it tips them over. But there are rare instances when you can get more dry after. So we are very careful about picking it up in advance if we can. And if you get it, we treat you. So those are the things, sometimes we just have to treat you for things afterwards. The long-term effects of, for instance, cataract, having dry eye, that's more rare. So you really don't have bad long-term effects with most of these surgeries. LASIK, for the most part, has been great, except for in a rare instance when somebody's been tipped over. So that would be the one.
What do you mean by tipped over?
To a little bit drier.
or what about when they have to redo it? Is that a rare
And
instance?
okay, and
Like
if
my
you have to
husband.
redo it, you have some other things that you have to consider. So we talk to you about it.
Okay.
If you're going to lift the flap or you're going to cut a new one, because there's corneal nerves that traverse across the flap. So
wow.
we do have some medications for things like that. But you just have to be aware of it. And sometimes if you're older, if you think you want to get a LASIK redone at 60, we might say at that point do a refractive lens exchange.
Right.
And then we'll save the last part of that LASIK if we need to adjust it for your final treatment.
Okay.
Okay.
So we definitely will redo LASIK. We do it all the time.
Yeah,
So we
my
can,
husband.
Yeah. Has he had it done?
He redid it. Yeah.
Yeah. And then they're happy for the next years. And,
Okay.
as far as long-term health, it's not, we're doing millions a year.
Wow.
Millions of cataract a year in the United States, let alone in the world.
Wow. Right.
Okay.
Wow.
And it's going up every year because more baby boomers are reaching that age where
Oh, right.
yeah, we have a whole population that is coming of age to get this done. So for the most part, we let you know. But I think that you don't have to be afraid of your long-term health.
Okay.
Yes, can things happen in any surgery? Yeah.
You got to give those
course.
You
disclosures
have to
every
know.
time.
You just
Yeah,
have
yeah.
to know
Sure.
what can happen.
Are there any common questions you get about ICLs or RLEs?
Yeah, well, ICL and RLE. ICL, I think people have to learn about it. And
Okay.
this is my
Just like me.
my
Yeah,
viewpoint
seriously.
is if you're seeking LASIK, ask about an ICL. It goes down to a -3. So if you're below a -3, you get LASIK for sure.
Okay.
Okay. From a -3 and up, you can choose an ICL if you want to. It's more expensive
Sure.
than LASIK because you have to go in and you do both. It's
Right.
because you're buying a lens that goes in, but it's removable, so you can. When you're older, if you get a cataract, you just remove it, and your eye has never changed. It's the same eye. You didn't change the shape like you do with LASIK.
Okay.
Because the LASIK actually changes the shape. Now, if you have astigmatism, that's great because it changes the shape of the cornea.
yeah.
But for you, Melissa, if you put the ICL in and it corrects your astigmatism, when you take it out, then the new lens will correct your astigmatism when you put a new lens in. So we'll be able to correct that astigmatism later. You don't have to worry about that. So ICL is additive and removable. LASIK is a procedure on the cornea that changes the shape of the cornea, and you take a little bit of the cornea off.
Okay.
So that's why we have to make sure you have enough cornea to do it.
Ah.
I feel like I just didn't know the right questions to ask.
No.
Like my optometrist, my ophthalmologist, what are some, like if you could give me 3 questions I should be asking so that I know, okay, this is the procedure or this is the route I'd like to take. What
Right.
would those questions be?
Well, the optometrist probably does not have the technology to tell you if you're a candidate for the ICL.
Oh, I see.
But what they can know is your prescription.
Sure.
Okay, so let's say they know your prescription is a -6 or a -8 or a -14 or -16, whatever it is. They can then say to you, there's a new technology called the Evo ICL that would potentially be great for you. And they would send you to someone who can measure you properly to make sure you're a candidate. They might look at your numbers and say you're too high for LASIK, so we don't want to even, but they should at least let you know about this.
Okay.
So the question is what procedures might I be able to have that can get me out of glasses or contacts? And you could search it.
Yeah, you
I just
on
didn't even
Google.
think.
You
I
didn't know it was an
know. I
option.
didn't know it was an option.
Yeah.
I bet a
Right.
lot
Because
of people don't know.
You were told that you couldn't have LASIK, so you thought
No.
it was over.
Exactly.
I did exactly.
Yeah.
I thought, okay, well then I accepted the
Blind
fact,
for
or
life.
what I thought was a fact, that
Right.
I'm either going to be blind for life, or I'll just have to wear disposable contact lenses
Mm-hmm.
for the rest of my
That's
life. You
right.
have literally opened my eyes.
Yes, and opened our audience's eyes.
Yeah,
That's
you
great.
have.
I
You
hope we get a
have.
lot of people to see it
know.
because
For sure.
it's so life-changing
For
when you do
sure.
this.
You are giving
and,
people back
and we
their
love
vision.
it because it doesn't the ICL even it doesn't change a thing. It's
Oh, gosh.
removable, it's additive, it doesn't cause dry eye. It's like pretty fabulous.
Incredible.
Dr.
It's one of my
Rowen,
favorite
Thank you
things.
I'm so glad you came here and like opened our eyes.
Yeah.
You just
Yes.
informed us about our options.
And there was one other thing I wanted to add, which is,
Please.
for the women's part that I wanted to
Yeah,
add,
women's eye health, for
Yes.
sure.
thyroid issues.
Oh.
That affects eye health.
Thyroid can affect
As you get
your-
older too.
Yeah, if you get
That makes
thyroid problems, you
sense.
get dry eye, and you don't even. Sometimes we diagnose thyroid conditions from the dry eye.
Oh, that's
And there are medications now called Tepezza, and there's a few other things you can. So I just want to make sure. We were talking about women's eye health.
Right.
yeah.
Okay, so our hormone changes, our makeup. So there are different makeups that are not good for your eyes.
Uh-oh.
The lash extensions probably
Oh,
aren't
lash
so great either because of
extensions.
all the glue and
chemicals.
things can collect in the glue and collect in the lashes.
Yeah.
So we don't really love them, but I know they're a thing.
What about the lash growth serums?
Like Latisse.
Lash growth
Latisse.
serums
Yes.
are fine.
Oh,
great.
good.
Yeah,
That's good to know.
But you don't want to get them in your eye. Now,
Of
Latisse is one that, certainly works. It can change your eye color. Like your eye color might not be the best one for Latisse. You got to
heard
find
that.
yeah, because your eye color can change.
I use this.
What about mine? I
natural
have
again.
yeah, the
I have
natural,
dark
yeah,
brown
different
eyes,
ones.
so-
Yours,
Yeah,
yours
yours-
might change.
Beautiful. Don't change it.
Yeah, I wouldn't use it because of my color is more like yours.
Yeah, we're
It's
very
hazel.
similar.
I've seen hazel eyes change, but it's a great product to promote lash growth. So those are good. It can change your skin color too. It made my skin a
really?
little bit darker, so I had to stop it.
Oh my goodness.
So I have terrible lashes, unfortunately. But I have great hair, so I'm okay.
You do have great hair.
I love
You
it.
do.
I'd rather have my hair.
Yeah,
I could,
everybody's
I could
watching this
throw
one, so
on. I could
listening.
throw on some lashes if
Sure.
I need to.
Yeah, totally.
Okay, so
Temporarily.
makeup. Some of them are not as eye safe.
Eye
as
friendly, yeah.
So we sometimes see women coming in with just tons of eye makeup in their eye. I'd rather see you put on something that's like a liquid, something that doesn't.
Oh my gosh,
Flake
settle.
you
off.
just brought me back. I just realized after I had LASIK, probably a year after, I accidentally broke an eye pencil in my eye, like the pencil part, not the color.
Yeah.
And it hurt so bad. And I was so afraid I ruined the LASIK.
Yeah.
I did
Oh,
not.
goodness.
But yeah, he had to work. He did something. I don't
Yeah.
remember.
Well, sometimes you have to
Kinda
clean it
dropped
out, but
or
we see makeup in there, so we would like
wow.
to find makeups that don't do that.
Well, Dr.
Thank you,
Rowen, we are
Dr.
so
Rowen.
grateful
Thank
for your
you.
time and
Yes.
for all the
Pleasure.
information that you gave us today and for literally opening our eyes.
Absolutely.
I
Well,
really
thank
am
you
looking
for
forward to the
having
next
me
time.
here. It was
Thank
a
you.
lot of fun. You
Oh,
ladies
good.
are fabulous.
Yay! Because we really want to know.
I know. Thank
Okay.
you.
Thank you.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube. Hey there, don't leave yet. Just wanted to say if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe.